first thing Dennis will have you do is we're going to take your temperature.
Sure.
Underneath the tongue, you can take it. You can take it and stick it in your mouth. Just underneath your tongue, just don't bite it, okay? I put a nice wrapper on there for you.
Officer Cole with Marshalltown Police Department again. Today we are at Post 1 for the Iowa State Patrol in Des Moines. We have started our field certification program where officers are now going through and they're actually testing live subjects who have been found under the influence of drugs and or alcohol together. The students are now going through their evaluation. They are going to go through about that for an hour, and they are going to make the classification call on what they believe that person is on.
You can sit down. Go ahead, buddy. Thank you.
110?
No. 98.1.
Hey, yes, normal. 110's bag, and I'm trying to be young.
So I take it, were you able to pee earlier?
No,
No.
but I will eventually.
Okay.
Because I'd come one get cleaned up and I just went to the bathroom. That's kind of.
Okay.
Normally I would be able to, just kind of nervous.
Just count for the temp and the vitals, or is this just we're gonna do another one when it comes time to that?
What's your question?
What are we gonna do? Is this the temp that's gonna count when we do vitals?
Yep.
We're gonna take another one.
Yep. Nope. We're taking it now so then he can start drinking some water for us.
I got you.
And that's something I really need to do. I don't want to talk or anything.
Okay, so you have temp?
You do.
Okay, go ahead and start drinking your water okay, as we go through
Now,
this,
do I
all right?
drink the whole thing?
What's that? You can drink the whole thing.
Okay.
Yep,
No,
absolutely.
I will. The reason I drink like this is I used to jug in the freezer and just flush it out with water. And a jug you really get it down. Sorry.
Do we know was Dennis a part of a crash tonight?
He was not involved in a crash. Pulled over for speed. He was extremely fidgety and agitated
Okay.
as he was being talked with. Noticed that he was his eyes appeared dilated.
Okay.
Than my partner's eyes were when we pulled him over.
Okay.
We used him for that. Ran him through field sobriety. He didn't show us any HGN. Walk and turn was 6 out of 8 clues, and one leg stand was 2 out of 4. He counted to about 40 to 42,
Okay.
if I remember correctly.
And did he have a...
Huh? It's just speeding.
Okay.
I'd have to go back and look.
Did he have a breath alcohol test?
Breath alcohol test is 0s.
Okay.
40 in the senior car and just going down. Try to slow it down.
What's your date of birth, Dennis?
6/20/61.
Keep going. I got you some paperwork over that.
Okay.
57.
All right. So it's 9:28.
Tape on you.
You're okay.
This is really, I've never heard of, and of course I didn't go to jail, but I've never heard of a program, but it really is,
Has he,
well, it tells me if there's anything possible, yeah, and it is what it is. It's
Miranda?
like me.
Yes, Miranda's Miranda.
do we know who that
Put
was?
in your back pocket for me, okay?
Do we know who that was given by?
Me.
Okay.
It's a sign.
All right, Dennis. Just to start off here, we're going to ask you some simple questions, okay? What have you been eating today?
Well, I eat, John, of course, for breakfast I had grits,
Okay.
but I make grits like, green. And then sometimes you can put cheese in it, you can have cheese
Okay.
with fish.
Yep.
But the farina or grits, and then ramen noodles, and peanut butter spoon out of jar. I mean, used to,
Noodles. Okay.
But I,
Peanut butter.
ramen noodles, yeah, peanut butter.
Is that all you've had today?
Well,
Peanut butter
no.
and jelly sandwich, or just
Well, yeah, but it takes, you gotta get the jelly out, and then my brother just crazy peanut butter, so I stopped buying Jif.
Barry?
But I like peanut butter.
Okay. So that's what you had for breakfast then, was the peanut butter ramen noodles
Well, I had
and
the
grits?
grits.
Just
but
grits.
But I make grits like farina.
Okay.
And I put sugar, I put milk, butter in it, and sugar.
Okay. So, anything else besides ramen noodles and peanut butter?
Well, yeah, I mean, I can not really mind to have cereal, ice cream.
Okay. But, I mean, for today, what's the most recent thing you've eaten today?
I just had ramen noodles,
Okay.
and I'm getting to have pizza.
And what time would that have been with the ramen noodles?
Oh, well, it was after I got back from probably an hour ago.
About an hour ago?
Because of what I take and I put onion powder and everything like the doctor that it's good for you.
Okay.
But it was just kind of my neighbor wanted to have pizza, and so the ramen noodles was just quick.
Okay.
But I do eat. I don't gain weight. But I do eat pretty good. I live alone, so I don't really cook much because it's just too much. Yeah.
How about your drinking? Water, Gatorade, anything?
No, it's milk. I should be drinking more water than milk.
Just milk today?
Well, I drink water too, but I drink more milk than anything. I should.
Okay.
Drink them out of jugs, so but there's been times where I've been
Okay.
fluids. You know what I mean? Because I'm not drinking water.
So, but for today's purposes, just milk? That's the one thing
Milk,
you've...
water, both.
Milk and water.
Yeah.
Do you know how much you've had?
Well, milk, I drink both out of jugs.
Okay. So if you had a gas cup, 2 cups, 3 cups?
3 cups of water and a quarter gallon of milk.
A whole gallon of milk?
No, quarter of a gallon.
Quarter gallon? Okay.
But I just love milk. But, I've learned
Nothing wrong with that?
I've learned that you're supposed to drink. I just don't drink enough water.
How much water?
Did you say 3 cups of water then?
Yeah.
Okay.
I drink it right out of the gallon jug side.
That's okay.
But the reason why I jam that down is because I put it in the freezer and I get it real cool.
So before this drink here, what was the last time that you had to drink?
Just for the house, water.
Just before you left the
Yeah,
house?
not milk. And it's $5 a gallon at the shop.
So would that be about the same time you ate your peanut butter and ramen noodles?
Yeah.
Okay.
Yeah. I get a milk. Milk is just, and you'd be surprised you can drink out of a gallon.
Yeah.
But I don't drink enough because I've had cramps and stuff, and they say it was from not having enough. What do they call it? I don't drink enough water.
Dehydrated?
Yeah, dehydrated. Because what I have is 2 herniated discs,
Do you?
2 bulging discs, and I wake up and they start cramping up on me. I thought it had to do with my. That was caused from
Okay.
water, but I do have 2 bulging discs.
Okay.
So it's,
So if you had to guess, what time is it right now?
oh, it's 6 o'clock.
6 o'clock? AM or PM?
Hey, or PM.
PM?
My boss gets out at 5. It was around 5.
Okay.
I left.
When did you last sleep, Dennis?
Oh, but myself this morning, I tried to get that circle. I take Circle in the morning. Well, they actually won't let me take it in the morning. What they've actually done is give me 400 a day. 2 in the morning, 2 at night. If I take it in the morning, it's groggy. So what I do, they won't, you're not supposed to take a lot. I take 400 at night. So because at 2 in the morning, I mean, it's an antipsychotic, it's groggy. So
Okay.
really, I take not much in the morning and 400 at night, at least 400 at night. Circle.
So did you take any of that this morning?
This morning I did.
How much did you take this morning?
200.
200 milligrams?
Each pill's 200, yeah. Yeah.
Do you know how to spell that?
Well, no, they call it quit. Circle.
Circle?
Well, they call it quit. It's not. They have a different name. It's quit but it's Circle.
Okay.
And usually at night, sometimes I take 600 at least. But I just can't sleep.
Okay. So how long if you had to guess, how long did you sleep last night or this morning?
Well, I didn't sleep very long because my brother kind of said, I don't want to get a long story. He said, what are you going to do tomorrow? He's going to stay at my house. Well, then all of a sudden this morning, he's calling his worker. He's calling his worker. Got to do. I said, Dennis, come on. Well, I was going to catch the 706 bus to start work on this car, and I couldn't leave. And that's kind of what started off when I couldn't leave.
Okay.
Well, this guy's kind of a wimp, and I don't know these computers. I'm a good mechanic at these computers.
Yeah.
I keep telling him, he gets these free checks down at the little store. I said, put the cards and they'll put them in their. And I'm trying to help him, but you can't do this.
I hear you. So what'd you say, like 1-2 hours maybe?
Probably an hour.
An hour?
An hour. And because my brother was there, and
Any naps today though? Since you got up? No naps?
No, I couldn't because I
Okay.
was in his van. I was broke down at Park First for 4 hours yesterday.
Were you? Are you sick or injured, Dennis?
Pardon me?
Are you sick or injured?
No.
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 Are you
that's it.
diabetic or epileptic?
No, this has some health issues.
No. So do you take insulin?
No. Nope.
Do you have any physical defects?
I have, no. I have the herniated
The herniated disc, 2 of them you said?
Yep.
How old are those?
Well, they said there were old injuries that in last year. I mean, they're going to do injections first. They have surgery. I mean, it's terrible.
Okay.
I've had to call an ambulance.
Are you seeing a doctor for that then?
Yeah.
Okay.
I go to the pain clinic at Broadlands, and they got to do injections.
You said Broadlands?
Yeah.
Do you know your doctor's name that you normally see?
The pain doctor I've only seen one. Dr. Christensen, my primary.
Christensen?
care. Yeah. But I have to, in order for my insurance to pay for it, I got to do physical therapy. They got to do injections first and then surgery.
Okay. So this Dr. Christensen works at Broadlands, and he's the one that's been seeing you for the
That's the
herniated
woman.
disc?
She's
Sorry.
my primary health care.
Sorry.
But
Okay.
then she referred me to the pain clinic, and I've only been there once. I don't really know her name.
Okay.
And what it is that in order for my insurance to pay for it, I have to go through physical therapy.
Gotcha.
And so but they have to do a referral. They're going to do injections.
Okay.
When did you have your herniated disc? You said a year ago? Is that
Well,
what started?
it started a year ago. I mean, I thought I was in good health, and it's about a year ago, and this part of my leg right here has been numb since then.
It numbs your leg?
Yep, this part
Okay.
right here has been
But
numb.
it started about a year ago?
Yep.
Okay.
And ever since then, now I get my sciatic nerves. I've had to call in.
Yeah.
I mean, it's,
You feel any of that right now?
yep, I sure do, my lower back.
Just in your lower back there?
And then, I'll start walking the sciatic nerve down both on one side or the other. And I take indomethacin for that. I take indomethacin, Lyrica, gabapentin.
Are those all prescribed to you, or are those over the counter?
Flexeril. Mhm.
Okay.
Yeah.
Okay.
And then, I'm not complaining, but it's just terrible. I mean, I'll be sitting there, and the thing about it is, I've had sciatic nerve pain for 3 days, but this pain that I had last time I called an ambulance, I couldn't stop it. And what it was I had a muscle spasm down one side, and
Okay.
it's terrible. You would not believe it. And last year, it's terrible.
Okay. So currently for doctor use, you see Dr. Christensen and then you go to Broadlands. Is that correct? Okay. How about a dentist? You see a dentist for anything?
No, I get false teeth. I just don't wear them. I get teeth.
Okay.
But I do have to go in for a pain shot. After the problems.
Okay.
Give me an injection right away.
All right, here comes the big one. Let's list all the medications you're on.
Okay, now, psych meds, the only thing psych med I'm on is now Seroquel.
Seroquel. And in your prescription, how many milligrams a day
Well,
are you
I'm
supposed to
supposed
take?
to actually take, she doesn't want me to take more than 400.
No
What
more
she
than
says
400.
is-
And that's Dr. Christensen, right?
No, that's Dr. Olson.
Where's she at? Or he?
She's a psych doctor at
She's-
Providence.
Okay. So Dr. Olson. Psych
She's my psych doctor.
at Broadlands. Okay.
And what it is she wants me to take, she actually got me prescribed taking 200 in the morning and 200 at night. Well, I tried that 200 in the morning. The Seroquel does not be silly. But I have a very hard time sleeping. So what I do is I don't take that in the morning. I take 400 at night.
And she's okay with that?
Well, she's not okay with it, but I can't sleep.
Okay.
She's not.
Says you could take up to 400
Well,
a day.
at the end when I was in town, she said, well, what do you really want? And she prescribes to me that in the morning I just cannot, I mean, it slugs you. Now, I used to be on Depakote, which is the mood elevator.
Yep.
I used to be on Risperidone.
Are you currently taking either of those two?
Nope, Circle only, Circle.
That's the only one you're taking now?
That's it. That's it. It's an antipsychotic.
Okay.
They say I have like a couple of my imperatives, they say like I have an intermediate explosive disorder type thing and kind of paranoid personality thing.
Okay. Okay.
Circle's the thing now. I used to take a handful.
And how long ago was that?
A year ago.
Just a year ago. Okay. So recently and currently, Seroquel is what you're using then.
No, it's psych med. Yeah.
Okay.
Now I take a lot of pain medications. A lot.
What kind of pain medications are you looking at?
I take Lyrica. I take gabapentin, Lyrica.
You said Lyrica?
Lyrica is the new gabapentin. But I do take gabapentin too. Gabapentin.
And then for Lyrica, how much of that are you prescribed?
I think it's something like 50 milligrams.
A day?
Yeah. Now the gabapentin is 600 3 times a day.
600 milligrams
Yep.
3 times a day, so 1,800 of that, huh?
Now I take indomethacin.
3 days. Say that last one again?
Indomethacin. It's inflammation medication.
Indomethacin. Okay.
I take Flexeril.
How much of the indomethacin do you take?
Indomethacin, I think it's 50 milligrams 3 times a day. How much? 50 milligrams. And it's really, really hard on your kidneys, but they have to check them. But yeah.
Okay. Then what after that?
I take Flexeril. Flexeril's a muscle relaxant.
Flexeril?
Flexeril.
Flexeril?
Yeah.
We have officers throughout the entire state here that travel for as much as 4 hours away that are going to be involved is students. The rest of the officers that are working with us today are all from the metro area.
How much of that do you take?
It just as needed.
As
They
needed?
give me 60 a month, and I go through it like you wouldn't believe. The fluctuate, yeah.
How many of those have you had today then?
Well, I haven't had none of them out.
None of those?
No, I missed the appointment, so she won't give them to me. But yeah, I take
Anything else?
no.
Nope. And who are all these prescribed by?
Dr. Christensen.
Those are all by Dr. Christensen. Okay.
Sure.
Primary care, where is she located at?
Broadlands.
She's at Broadlands too.
And it's, primary health care to all in the parking lot, yeah.
Okay.
And then sometimes I have to take CAT and not do an injection, a shot.
Okay.
And I mean, there's sometimes I had to take I took an ambulance last time, shot, injection, two injections. One for pain and one for anxiety.
When was that? How long was that?
2 months ago.
Okay.
So you haven't had an injection in 2 months, is that right?
Yeah.
Yeah, right, yeah. Yep.
Okay.
But the last time I went, I mean, they didn't believe me. The lady in the ambulance said, quit acting like a baby. I said, wait till I get to the hospital. And he said, I started telling him, no, I didn't. I said, I had a baby. Oh. Yeah, I mean, I couldn't believe it.
Okay.
It's a lot more painful than people think. It's, I can't believe it. What it is it's like this, they're herniated and they're pushing the nerves.
Okay.
And it's the sciatic nerve, and it's terrible. And then now starting, what it is, L4 and L5 on this side, but then now they're saying, are you constipated yet? Are you, and I'm like, what am I going to wake up paralyzed in the morning?
Yeah.
And it's terrible.
Okay.
Since last June, this has been numb. This part here has been numb, this part of my leg.
Is it numb right now?
Yeah, it is.
Okay.
They give me, I'm taking lidocaine gel.
So we have officers who have been certified as DREs, matched up with area law enforcement agents, including Iowa State Patrol, Ankeny, Altoona, and Des Moines. Those officers are currently out on the streets right now. They are looking for people who are impaired, and they are bringing them here into the post. We have two subjects that have come in that have been found to be under the influence of drugs and are now going to be going through the process. So we're going to basically, as an instructor, I'll be with them and going to make sure that they go through the process correctly and that they are getting the proper feedback from the individual so that they can make the classification call that they need to make.
How much of that are you? 5% you said?
5%.
Have you taken some of that today?
No, what it is it's numbing gel.
Okay.
It's the same thing with dentist burn your teeth. Yeah.
Okay. When was the last time you had that?
I got it at home now. I take it, if it's getting burned. Yeah, lidocaine. Cream.
It's an ointment you put on?
It's 5% lidocaine. It's with the same thing with dentist burn your gums, the numb it with.
Is that Dr. Christensen sending that,
Yep.
that one too?
It's lidocaine. It's the same thing I guess the dentists use when they put
Okay.
up soluble.
And when did you last have that?
Well, it's probably been about a week. What it is it numbs it just it's top of it numbs the top of the skin. It's when you start getting burning, it's nerves.
Okay.
So it's a lidocaine. And I'm sorry, I know it's a lot of stuff.
That's okay.
I used to think,
Well, we appreciate you helping us. Or
I
helping
thought,
us.
What
so.
is 57? I just remembered in this last year. Yeah.
Okay.
And it started last June, and it started here, and then it's just gone. It's just gone downhill. And sometimes you point like, shoot, I'm gonna go to the hospital injection. I'm sorry, guys.
Okay. Do you wear corrective lenses at all? You wear contacts?
No, I wear glasses, but it's just they
Right,
say
not right now, though.
No, I do wear the bifocals, but they say my eyes are typical for my age. I don't want to admit I'm used to carrying glasses around.
So what you need to put in there is you need to put in there the glasses, but none more at this time. Okay? Don't mark
I
none.
think I'm gonna start to though.
Because if he shows up in court wearing those glasses, then you need to be able to document that, okay?
Can I see my phone? I think it doesn't. I just gotta see. Probably that trick.
Real fast.
It might not be. I don't know what it is. It's not. I don't think it is. No, it's not.
Okay.
I think it is.
All right.
He's gonna repeat that.
All right.
I'll tell
You
you.
blind in either eye?
No, I'm not.
Okay.
I think my vision's 50-20, but
Okay.
I think I'm gonna really start carrying glasses around.
All right.
And this is I got a lot of problems with health.
If you want to just lay that wrist up here for me, we're just gonna get a pulse for you, okay? Just have you hang tight. Don't move your
What's
arm.
an age? I'm sorry.
Try to be as still as you can, okay?
Yes, sir. Yeah, I started taking it about a year ago. They actually, I'm in good health, they say. Oh, but last year, man, I feel like 7 now. But other than that, all my brothers got emphysema. My lungs are clear, my good. My memory's gone. I do 4 things and I'm gone. I can't remember nothing anymore. I mean,
Okay. Follow your eyes. Keep your head still for me. Look at it with your eyes, okay?
I'm sorry.
I need you to focus here.
I know, I'm sorry.
All right,
I'm
here
sorry.
we go.
I think I'm getting vertigo.
Hang tight for me, okay? We're almost there.
I'm Philip Krikow. I'm a substance abuse counselor with the United Community Services, and we're out of Des Moines, Iowa, and we have offices in Ankeny and also in Knoxville. Some of these people who might want to decide to make some changes, I'm here to give them that opportunity and ask them to possibly come to outpatient treatment, come get an assessment anyhow, and just see what we might be able to do for them. Dr. Paul Aishman, our clinical director, he's got a brother in law enforcement, and I think he found out about that. And then one of the leaders decided that it would be nice to have a substance abuse counselors here, and they invited us to come and do this. Well, we're not really able to follow up on them, but I believe that there were some that came. Usually, if they come to see us, they'll say something about how they found out about us and things. Okay.
Are the Crocs feeling okay for you?
They're just
If you want, you can take them off.
well, no, because I know.
Okay, we'll keep them on then. All right. So let's keep those hands at our side, okay? So for this test, what we're going to do, or you're going to do, is you're going to raise that leg about 6 inches off the ground, parallel to the ground, okay? Nope. Just let me finish, okay? So we're going to keep the foot off the ground. We're going to look at that toe. We're going to count 1,001, 1,002, 1,003, so on until I tell you to stop. Big thing to remember here, we're going to keep the leg straight. Yep, keep this leg straight. We're going to keep our arms down at our side. Okay? Okay? So okay, things to remember. Foot 6 inches off the ground, parallel. We're going to look down at that toe. We're going to count out loud, 1,001, 1,002, so on. We're going to keep our legs straight, and we're going to keep our arms at our side. Any questions before you start? Begin. I don't. Go, other leg, other leg, other leg. Raise your right leg.
See, I just can't remember. Instructions do things. You know what I mean? When I was in school, I couldn't do instructions.
Count out loud for me. Keep your hands at your side. Count out loud. Look down at that foot.
It's just a balance, not drunk. You know what I mean?
Stop.
You know what I mean? It's not nice. Balancing.
That was 30 seconds.
Pleasant as pie, right?
Okay.
More flies with honey than vinegar. So let's give them the opportunity.
You just want me to do it again then?
Go ahead and stand on right leg, do left leg.
Okay.
Okay. And just make sure you show good instructions and good demonstration when you show it to him. Okay. And give him every chance to see it, hear it, and do it.
Okay.
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 So go at it from that standpoint.
You raised the right one the first time. We're going to raise the left one this time. Same thing again. 6 inches off the ground, parallel to the ground. Look at that foot. Count out loud. 1,001, 1,002, 1,003, and so on until I tell you to stop. You keep the leg straight, hands down at your side. Okay? So again, We're going to raise the left foot off the ground. Okay, about 6 inches off the ground, parallel to the ground. Look down at that foot, keep your leg straight, hands at your side, and count out loud for me. Do you have any questions before you start? So remember, count out loud for me.
Sure.
Okay?
Ready?
Begin. Count out loud.
1002, 1003, 1004, 1005, 1006, 1007, 1008, 2009, 2010,
Look at your toe for me.
2012, 2013, 2014,
Stop.
Okay.
If I really could concentrate.
Yep. Good job. Just relax for a second, okay? Let's
Just relax
talk
for a second.
Okay, much better that time. Okay, making sure that you have all those instructions down, you got them down pat. He was able to understand those and actually give you a good test performance on that. Okay.
Wasn't really hopping, but he kept grabbing.
Quick hand moves,
Yeah.
grab hands.
Yeah,
Just put that in
absolutely. That's a great note to put in there. Okay. Correct. What do we need for hop? We need actual.
Yeah,
Right?
actual.
Okay.
Yeah.
I think I'm sounding kind of like that. I have
there. That's a sway, okay.
I would call that more sway than I would hop.
Yeah, I'll put it-
He needs to step.
Let's stick that back on before we know where you're at, know who you are.
So on that one,
Okay.
he actually, since he counted, we put it down at
Right.
2
Okay, and remember, when do we start the clock? Not when we say start, but
when he starts counting.
when they starts counting. Okay, so make sure you start then. Okay, that'll help you out in that one. All right?
Okay.
Good job redirecting on that, okay?
Do we know if one of them is open? That one's not. That one's not?
So the students will be going through a 12-step process. The first process is going to be a breath alcohol test where we actually take the subject's breath sample. Here in the post, for the purposes that we're doing here, we'll actually use what's called a PBT, which is a little handheld unit. Some police stations and law enforcement centers will have what's called a data master, and they'll be able to go ahead and take the sample with them that way. After that, what the student is supposed to do is go through and interview the arresting officer. For the purpose of the field search tonight, what we do is, as an instructor, I'll make up a small story and kind of tell them something that happened and the reason why they're brought in here. Now, the reason that they were brought in here could be a different array of things that's happened, and then these subjects are basically given the option that, hey, come in, comply with us, and we'll work off some of those charges with you so that we get a good learning environment in here, and the students have a good hands-on experience. After that, we go through what we call the preliminary examination. That's where we take our initial pulse. We do a quick eye assessment where we check to make sure that the pupil sizes are equal and that they are able to track our finger as we're moving in front of their face. We then go through a more in-depth eye examination where we look for the horizontal gaze nystagmus, which is broken down into 3 different tests, segments involved in that. After that, we do a vertical gaze nystagmus test, and then what we do is called a lack of convergence. That's where they take the finger and they go around the face and come in towards the bridge of the nose. What we're looking for is to make sure that the eyes are actually able to cross and stay crossed at the bridge of the nose. The fourth phase that we have, or I'm sorry, the fifth phase that we have is the divided attention test, and that's where we do the things like what's called the modified Romberg, where we'll actually have the person tip their head back and estimate the passage of 30 seconds. Things that we're looking for there are time and how their internal clock is with an actual 30-second clock on our watch. We'll then do the walk and turn test, and then we go into the one-leg stand test. These are validated tests through several different studies throughout the 70s, 80s, and 90s that were the original basis for field sobriety testing when we talk about OWIs and anything like that. After that, we'll do the finger-to-nose test, which will incorporate the subject touching their finger to the tip of their nose using left or right. And what we're looking for is them to actually touch their finger and bring it right back down. The sixth phase that we go through is vital signs. We do another pulse. We then do blood pressure, and we check to see how the body's reacting to those drugs that they've ingested and how they're going about that. We'll also take their body temperature. For purposes of some of our subjects tonight, we go ahead and get that body temperature right out of the way because we're trying to be as efficient as we can in moving students through the evaluation process, and we need to get water into some of these people due to the drugs that they have consumed. It tends to dry them up, and it's very difficult for them to provide a urine sample for us. We then go inside to a dark room, and here at the post we're going to use the restrooms here, so we have a near total darkness environment. We're going to sit in there, we're going to wait for a period of 1.5 minutes or 90 seconds to let the eye adjust to the darkness around them, and then we see how the pupil reacts. Before we go in there, we actually check in near normal conditions, or what we call room light, and we're seeing what the pupil does. The pupil will react to the drugs that those people are on and change how the pupil size is when it does that. And then we're going to use a pen light, and we shine that directly into their eye for about 15 seconds, and we watch to see how the pupil reacts to light, whether it's normal or there's a delayed reaction when the light comes in there. It should be an immediate response.
What? Just for my own curiosity, how did we end up coming across you?
Oh, my window tint was too dark, I guess.
Dark tint.
Okay.
Get you every time. Anything else?
Last time I didn't have plates on the truck.
No more questions.
Okay. When he says a bowl, how much is a bowl? I mean,
Specify.
specify it. Yeah, figure out how much. Yeah, figure out how much they roll. The other questions, and I've already asked these to him, and I'll ask just ask him again. Yep. So I say hey, on a scale of 1 to 10, 1 being ditchweed, 10 being the best BC bud that you've ever smoked before, rate the weed that you smoked today. About a 7. Do you know roughly what the THC count was as far as percentage?
Probably 25 to 26.
Okay. Where do you get that from when you get it?
I have a dude I know that gets it from Colorado. Right?
So does it come with a label on it that shows what the
No, it doesn't
percentage
come
is
with
or
a
anything like
label,
that?
but,
Okay.
I know he tells me most of the time what he
Okay.
thinks and this and that.
Okay.
I've been there before, so I kind of understand how it all works.
Okay. All right. So your high today, at the best part of your high, 0 being stone cold sober, like if you're maybe out working on a tower or whatever, and 10 being the highest you've ever been. Where's your high at today while you were driving?
I would put it in a solid
6. So what that does is, especially when we go to like a jury trial or something like that, what should someone who is not under the influence say when I say 0 to 10? Should say 0, exactly. So anything more than 0 means they're feeling high. So that's why, I like to ask that question when it comes to that standpoint. I also like to see where they rate it. A lot of guys who smoke marijuana will also tell you just about everything other than where they get it, and they'll even tell you how much they're paying for it. What are you paying for a gram right now?
Well, I buy half ounce.
So you buy a half ounce at a time.
$150 a
Okay. So, just kind of good to know. I mean, it's just streetwise yourself up on some of these things. That way you kind of know.
I get a pretty good deal, by the way, for that.
Yes, you are. $300 for an ounce is a little cheap. You're getting what, about $100 discount on that? Yeah. So he should be paying 2 for a half ounce.
Okay. Anything other than come here and just
So-
your finger for that second when you drop it.
Those are the kinds of things you can start to understand, and just like he said, I understood that, yeah, you are getting a discount on that, and it should cost you about $400 for that ounce. So, okay. All right. Any other questions you want to ask him while you have him here, guys?
No questions.
Okay. All right. You guys are spot on your deal. Can you give me a urine sample now?
I think so.
All right. Do you have like a smooth pursuit?
No.
Okay. Is it a focus issue then, probably? You think?
It's possible.
Okay. All right.
Level still.
Okay. Jake, do me a favor, real quick. Stand up for me. I just want to double check. Do me a favor, flip your glasses up for me real fast. Okay? We're just going to check you real fast, all right? Almost done, okay? Just relax for me as best you can. No, you're fine. You're fine. Never say never, never say always, right? It's there. You're
Probably not substance abuse.
yeah.
It's still documented there as a clue though.
It was there, right?
Yeah.
Okay. So basically, what that would you know, if there is an issue later on where you would see, you know, he would come in and say, yeah, I've got a brain injury, a traumatic brain injury, or, you know, something like that, we at least have it documented that, hey, so what side of the brain would we associate there you go, okay, right, remember, opposite side, right? Okay, so yes, you're spot on there. You saw a clue. It is there. There is nothing else going on. Okay, spot on. Okay.
But let me ask this. Hold on.
Oh, his cycles are
He's
good.
obviously tweaking hard, isn't? But has he got good clinicals, like dilated pupils and things for them to see? It's going to help them. Obviously, the
Barry, let me see your face sheet again real fast on him. Your notes on on Dennis. Okay, Mike's looking at it.
Okay.
Potentially, Todd. So while we're in the dark room, we do things like we look inside the nose, we look inside the mouth, we're looking for the areas of ingestion to see how people may potentially be using drugs. There's also some signs with marijuana use, snorting powders and things like that will affect the nose hairs, things like that. After we're done with that, we come through and we look at the muscle tone of how the person is. Drugs will affect the feel of your muscles. Things like stimulants will make your muscles very rigid and very stiff, almost like you're lifting or flexing your muscles. Other drugs make your muscles feel like Jello in a plastic baggie, for lack of a better term. It's a different feel to it when you have that happening. During that same time frame, we're looking for injections, and that's where our subject Dennis was showing us those track marks in his arms and throughout that tattoo, where he's actually used so long that the vein is scarred and collapsed, and it's not even usable anymore as far as that goes. So, that's long-term effects of using drugs and using IV drugs when it comes to that kind of thing. So. Those are really good things for students to see and to observe on people. After we look at that muscle tone and we go through those injection sites, we take our third pulse. So we get 3 good readings of how the heart is being affected by the drugs that have been ingested. After that, we look at the totality of the circumstances. We look at what we call our face sheet, which is our note-taking sheet. That's standard throughout the entire nation on how we document all those things. That's what these guys are using right here on their clipboard to take notes on. You look at that, and then you form what we call our opinion. It's our expert opinion. And then we confront that subject on what they've been using, which in case of Dennis was apparent that it was methamphetamine and what he was doing there.
How do you inject it? How do you?
Oh, yeah. Now, I don't want you to think it's a crazy thing, but it used to get scared of me years ago. And I've never
just out of curiosity, that whole story about the air conditioning.
Well, no, that's true. That's you know.
So where do you inject that then?
Right here.
That's okay.
And see, do you see up there?
Yep.
That's from 1990. Right, that group. See that group? 1990.
Yeah.
Right here.
But that's
Yeah, but
you're
look
also
at that
using
right
that vein to
Yeah, but
inject,
look at
right?
that group from 1990 to 2007.
Okay.
That group.
Yep. Oh
Because
yeah.
it takes
Yeah.
But see, if you look at it, that is one permanent scar
Right. From
that
19
runs down there
from 1990.
from injecting so many times as you go through.
And there's one there too. See?
You've got-
It's down there too. There's a group. There's a group.
Right here. Those are veins that are blown. They're collapsing.
This is collapsed.
They're never. Yep.
That was from I started there in 1990 to 2007. There.
So
I'll be honest.
yeah.
In this group.
Huh?
And now what it is
Thrombosed?
this vein here, and now that's the reason why you see this here. That's because the
Never mind.
vein is.
Yep. Because it's blown out.
Yeah.
So
That's what it is. And I mean, I got it.
So did you use them
Yeah,
at
you're right. That's
use them
what
at your
Leonard's
house,
saying now.
at your brother's house?
Well, I don't really
What's
do.
that, Larry?
I mean, if you're a good judge character, you come to my and my house is clean. I don't really use it much anymore. But when I do, it's a.
So did you
I agreed with what their
agree
call
with-
was. Yes.
Perfect. Make sure Scott knows that.
Okay.
But I think he does already.
Okay. Scott, on Dennis, our first guy over here on STEM, we made an instructor call. Is that correct? With no sample? Okay. All right. I agreed with them on what they saw.
Yeah,
There was no issues there, I don't think.
yeah, there definitely stems involved.
Yeah.
What,
And we talked about how you know, he's saying that he's taking the dissociative, or not the dissociatives, the depressants.
Right.
And that, you know, hey, it's
Were you seeing
prescribed.
signs of any of
No, we're not. And he was wondering that we were, they pulled up a good point. They were wondering why there was no signs being shown. And we talked about what's psychoactive, what's not psychoactive at the time. And they really picked up on that really well. And
therapeutic doses.
yeah. So, all right, I just wanted to, I thought that's what was going on, but I wanted to double check and see what was going on there
don't
so I
know
can
if-
mark that on my sheet.
I don't know if he explained to you, but he did to me. Those are epidurals he's getting,
Oh, okay.
not pain shots.
I didn't go through any of that with him at the time. I was letting them deal with their
Yeah, I did.
evaluation as they were going.
Talked to him for a while.
So that was a chore.
Yes.